Hello, everybody. Today, we have one of our first inaugural graduates, Dr. Jessica Jacob. And not only was she one of our first inaugural graduates, she was the SGA president, provided outstanding leadership for her class. And as we approach the 6-month anniversary of the first class graduating, we wanted to get some updates on some of our members as to what they're doing at this time. And so Jessica, thank you for joining me.
Thank you for having me. I really appreciate the invitation.
That's great. It's great to see you. And for those that are watching, she'll talk more about it, but she's in infectious disease unit right now. And obviously under full PPE gear, which is understandable. And so Jessica, just to start with a question, tell us a little bit about where you're at. And some of the highlights of what you have experienced in your first 6 months of your residency.
So I guess to start, it would be that I'm part of kind of an evolving residency program right now. So it's the Creighton University Arizona Health Alliance. And so what that entails is that Creighton University, which is in Omaha, is actually starting a new campus here as a 4-year school in Phoenix. And so they took 2 existing residency programs, one at Valleywise Healthcare and one at St. Joseph's Hospital and Medical Center, and they're making it into a combined program. And so I'm part of the second class that's completely combined. So about half of my rotations are done at Valleywise and the other half are done at St. Joe's. And that kind of leads me into my why I'm really enjoying where I'm at is that there are 2 completely different patient populations. Valleywise tends to serve the very underserved community, and St. Joseph's tends to be more of the affluent community, as well as have more diversity when it comes to cancer patients, because we have the cancer center, as well as neurological patients because of Barrows. So I'm having a wonderful time.
Well, you're in a great location and great environment, and to have that dichotomy between the patient populations is, I think probably makes the residency more valuable than if you just had one type of patient base. It seems to me that would be get a little bit monotonous versus what you're doing right now. So that's terrific. As you think back to your time at Burrell, what sticks out when your 4 years that you were here that really helped prepare you? It could be academically, it could be, non-academic. What are some of the key things that really helped you prepare for competing for the residency, obtaining the residency, and being able to do what you're doing right now?
So for me, I think I'm probably unique in that for the inaugural class, we had a wide opportunity to get really involved, not only with leadership opportunities, but really build our relationships with the community. And for someone like myself who tends to be involved in all, I think that really helped me because I'm already involved in 10,000 things here. So, yeah.
Great. Good. So we have students that will probably watch this that are at Burrell right now, applicants that would be looking to possibly come to Burrell. What advice would you give them, top of mind advice, that what they need to do to prepare to compete for a residency and to obtain the residency? What advice would you give them?
Okay, so that's kind of a different question than what you said in your email, so it's going to take me a second here. But one, just always go for it. Stay true to yourself, and if you're doing something that you love and something you're passionate about, then the rest will kind of fall into place. And so for me, being in leadership, it was very easy to do that. If that doesn't come naturally to you, don't do it. Don't force it. If you are somebody that loves being in the community, do that and tell your programs about it. Find what's unique to you and stay true to it. And don't be afraid to talk about it, because people think that certain topics are taboo. and such as people brought up like maternity leave on their interviews. And I know that's a no-no, but actually a lot of the program directors responded very favorably to these people that brought it up. And so if it's something you're passionate about and something that you want as part of your program, don't be afraid to ask those questions, because you'd be surprised at the response, number one. And number two, if that they respond negatively, it's probably not a program you want to be at anyway.
Good point. Good point. And that's great advice. And, you know, some of the other conversations that I've had with individuals of our alumni is the importance of mentors. And how would you encourage, you know, the students to really, if they don't have a mentor in the medical school right now, you know, how important is that? How important it was to you? And can you think of some mentors that really helped you encourage you through your journey?
So obviously the Physio brothers, which include Dr. Rodenbaugh, Dr. Osborne, and Dr. Benoit. But again, very unique here is I spent every day of 2 years crying in their offices. So in that respect, find somebody that you feel comfortable talking to, that you feel like you can be open not only about your like academic successes, but your failures. And somebody that will be open with you with feedback. So just find, it doesn't need to be like mentor, mentee mentality. It's somebody that you can go to, that you can count on. And you may find it in the school, or, you know, one of my preceptors, Dr. Tryon, he took me under his wing like I couldn't tell you. And he really served me a lot. And it's somebody I can pick up the phone and call now. And so just, it has to be somebody that you click with. It can't be something forced. But I do recommend doing it.
Yeah, good advice. Great advice. I have two questions that are kind of I have to answer these questions, ask these questions done with our other students. Is so what about Las Cruces do you miss the most when you think about Las Cruces, your time here? What about the community top of mind that you say, man, I really miss that?
Actually, this is a topic that comes up quite frequently in my household. So it's probably on a every other day basis. We mention something that we miss about Cruces, either the closeness to everything or, you know, just the whole culture there, I think, is what we miss the most. And obviously green chili. Green chili is the number one most missed important thing in
better
my
than
household.
red. Better than red.
Needs to have it. We actually went down and got like frozen ones to bring home. But yeah, just that mentality of like that slowness, but that very much togetherness that I think Cruces had. Everybody knew everybody and everybody was so supportive.
Great. Super. And then you remember the graduation, unfortunately it was virtual, which we wish we didn't have, but we did the best we could. And the governor was our keynote speaker. And if you remember what she said she has her eye on all the graduates. And so I have to ask the question is, you know, given the opportunity after your residency, if there was an opportunity to practice, to set up a practice or to join a practice in New Mexico, in the region, would you definitely be open to that? Would you look at
100% without a doubt.
Okay, great. That's awesome.
Yeah, that's a very quick answer for me. It's something that my husband and I have talked about quite frequently. So,
right. Yeah. That's I can't tell you how important. I mean, like I said, you were a true leader, and your fellow students looked up to you. I know that individuals in the faculty and staff looked up to you, and to have you come back to our region and to our community to practice medicine, that would be the ultimate fulfillment of our mission of what we're trying to do. And so that's why our Alumni Association, which, by the way, everybody watching, Dr. Jacob is going to be the inaugural president. Her president duties are not ending, and she will help us get the Alumni Association off the ground on that as well. So our goal is just to really stay in touch with everybody, to learn about everybody's progress, not only professionally, but with your families, your accomplishments, personally, your hobbies, whatever, just to make sure that we continue to keep that closeness that you talked about, as difficult as it may be as we're distanced from each other. So I appreciate your willingness to do that.
Absolutely. Thank you for inviting me to do that.
Great. Super. I'll give you the last word. Anything else you'd like to say?
Whether or not you're applying to residency or medical school, you got this. Take a deep breath and do something for you throughout all of it, for your own sanity, I promise.
Great. Great advice. Well, thank you, Dr. Jacob, Jessica, and we wish you all the best, and take care.
Take care. Nice talking to you.